Hello, I'm Andy Kalanko. Welcome to Speakeasy. My guest today is Allan Kaufman. He is a speech coach and consultant who has helped many people overcome the fear and anxiety of public speaking. But on our program today, we'll be talking with him about another type of fear and anxiety, that which comes when one receives a diagnosis of cancer. About 2 years ago, Allan learned he had prostate cancer. And since then, he has been treated for the disease, and he is doing well. He's now a member of a support group that helps others learn about the various treatment options that are available. He's here today to share his experience and tell us why he chose proton beam radiation therapy as his treatment. Allan, welcome to Speakeasy.
Hi, Andy. Thanks for inviting me.
Thank you for agreeing to come on and share your experience. It's nice to have you back.
Thank you.
Let's first of all address the question about prostate cancer. Just who gets it and how prevalent is it?
Men get prostate cancer. 1 out of every 6 men will be diagnosed with prostate cancer. Mm-hmm. That's compared to women. Women get diagnosed with breast cancer, 1 out of every 9 women.
Okay, so it's very prevalent then among men.
In fact, it's more prevalent than women getting breast cancer.
Are certain groups more at risk than others?
Turns out that African American men get prostate cancer 1 out of every 3. Mm-hmm. 1 out of every 3 men as compared to 1 out of every 6 men on average. Mm-hmm. But also, if you have a history in your family of prostate cancer, let's say your brother has it or your father had it, or even if your mother got diagnosed with breast cancer, mm-hmm. your odds of getting prostate cancer go up mm-hmm. substantially. In fact, may go as high as 90-95%.
Mm-hmm. So it's a disease that many men have had. I know I'm aware of, for example, that Mayor Rudy Giuliani, for example, was one person who had cancer for a number of years, and he has survived and is leading a very active life. Are there others that we know?
Well, there's Colin Powell, General Schwarzkopf, Senator John Kerry, Arnold Palmer, to name a few.
Yeah, and I understand that the actor Sean Connery actually had prostate cancer too.
Right. Now,
what is the survivability of this disease?
Well, if it's treated early, the survivability is very good. It could be as high as 98-99%.
Okay. Well, before we get in, later talk about how to prevent it, let's just tell our audience what is the prostate. What is prostate cancer?
I'd be happy to do that. I just want to mention that about 230,000 men get diagnosed per year in the United States, and 30,000 men actually die from prostate cancer. So it's important to be aware of it and get checked out and be aware of the signs and symptoms and get a physical on a regular basis.
Okay. Well, let's get back to then what is the prostate and how does this happen?
The prostate is a walnut-sized gland. Mm-hmm. And the purpose of the prostate is to generate fluid to enable the sperm to create semen.
Okay. So are there any specific symptoms? How does one get an indication that he may have prostate
Well, one
cancer?
may have actual physical symptoms in terms of urinating. That may be due to an enlarged prostate or for some other reasons. And at that point, you want to have yourself checked out by your doctor.
You mean like frequency of urination?
Frequency or
infrequency
or pain. For a lot of people, they have no symptoms.
Mm-hmm.
In my case, for example, I went to my doctor for my regular physical, and because I was over 50, my doctor did something called a PSA test, which is a blood test. Mm-hmm. And what it is, it measures some kind of an antigen in the blood. And if that level goes up from 1 year to the next, that's the most important sign, if it goes up from 1 year to the next. Mine went up from 2.7 to 3.5. Mm-hmm. So what my doctor said to do was, let's wait 5 or 6 months and have another PSA test done. Mm-hmm. And if it goes up again, then he was going to send me to a urologist.
Now, is that an indication that one has cancer, or is it just...
No, it's just an indication that it's a higher possibility, and it's something that needs to be looked at.
Are there other techniques or things that are used to determine whether someone might have prostate
also
cancer?
When you go for your physical, especially if men over 50, and actually they're trying to lower the age now, they're recommending maybe over 45 or even 40 if you have a history of prostate cancer in your family, that when you have a physical, you have something called a DRE, which is a digital rectal exam.
Okay, it's sort of well-known and kidded about by men. Right.
Yeah, we all know what that is.
Yes.
And the doctor will actually feel your prostate and determine whether it feels out of shape, enlarged, or whatever, and that may be also an issue that he might want to send you to a urologist to take a look at.
Okay, so if he felt like a lump or something, it might be that there's a tumor there, and then
Could be.
then we'd have to have that checked further.
Absolutely.
On the other hand, if he finds that it seems smooth, that there's nothing there, does that mean you're safe?
No, it just means that they'll probably look at your PSA level, and if your PSA level has gone up significantly, they may send you to a urologist for further testing.
All right, so in your case, you had a PSA that was rising?
It was rising. Went from 2.7 to 3.5 in 1 year. Within 6 months, it went up to 4. 4 used to be a magic number. It's still kind of a magic number that they were concerned about. But more importantly, my number had gone up from 2.7 in a year and a half later to 4. So he sent me to a urologist.
Okay.
And when I went to the urologist decided biopsy.
Okay, and a biopsy involves what?
A biopsy is not a fun thing. And I just want to mention one thing. If you ever have to have a biopsy, make sure your doctor gives you an anesthetic. If he says, oh, you don't need an anesthetic, switch doctors, right? Okay. Now, what do they do during a biopsy? Well, they shoot some kind of feels like a gun into your rectum at your prostate, and they're taking samples of your prostate.
Okay, so they're little snippets of tissue.
Snippets of tissue that they're going to look at under a microscope to determine whether you have any cancer cells, and if so, what do they look like, and
Okay.
they give you a score to determine if it's localized or if it's how much they've grown, that kind of thing.
So they're looking for cancer.
They're looking for cancer.
So they might find that there's no cancer there, and then you're cancer-free.
One thing about it that's very important to know is they need to take a large sample.
All right. How many sample
For me, they
tissue
took
is
12 They took 12 samples, but it's recommended they take maybe 20 samples because you have to understand, the more samples they take, it's more likely that if you have cancer, which if you have it, you want them to find it. If you have it, the larger number of samples they take, the more samples they take, the greater chance they're actually going to find it.
Okay.
Because if they don't take enough samples and they don't find it, that doesn't mean you don't have it. That just means they're going to probably come back 6 months later if your PSA continues to rise, and you have to have another biopsy.
Okay, so they take the tissue samples, and then they send them off to a lab, and they're looked at to determine if the cancer is there, and if it's there, just how prevalent it is, or what stage it is in, right?
That's correct.
Okay, so then what happened in your case?
Well, in my case, out of 12 samples, they found cancer in 3 of the samples.
Okay, so you didn't appreciate the bad news.
Well, I was glad that if I had it, they found it.
Okay.
With 1 biopsy, so
Right.
that was good. It turns out I had 3 samples, 2 of them were at 1% each, very low level. 1 was at 10%.
1% of the sample?
In other words, in this sample snippet, they found 3 occurrences of cancer. And in that snippet, they determined that it was only 1% of the snippet was cancerous.
Okay.
In 2 different snippets. And then in the third one, 10%.
Okay. Now, is this unusual? Is this common? Do you know?
I don't know if it's common or not common, but it was very localized for me, very low level. I caught it very early.
Okay, so does that mean that the cancer hadn't progressed beyond the prostate?
That's correct. It wasn't, it hadn't even progressed within the prostate that much.
Okay.
They caught it very early. They also attached something called a Gleason score to my cancer cells, and my Gleason score was 3 + 3, which equals 6. And it's a determination of how intense the cancer cells are.
So what does that mean? On a scale of 1 to 10, it's a 6? Is that...
Well, there are 2 different numbers without going into a lot of detail, and I'm no doctor. I have to tell you that right up front. 6, most people, if they get diagnosed early, most people end up with a Gleason score of 6.
Okay. Now, prostate cancer is curable.
It is if you catch it early and you have the right treatments.
Okay, so now you were faced with the decision then of what treatment are you going to receive. What are the basic options that a patient has for being treated for prostate cancer?
Well, the main treatment, this is what they call the gold standard. This is the main treatment that most urologists recommend. Understanding that most urologists are surgeons, they recommend prostate cancer surgery, where they actually remove the prostate.
Okay.
They say it's the gold standard because if, we remove the prostate, we get all the cancer, you're gone, you're safe. And that's what they recommend.
Okay.
However, along with having prostate surgery, removal of the prostate, you have a very high probability of two major side effects: incontinence and impotence. 2 things we guys don't want to have.
Okay, I guess
Not good. Now, there were other options. Another option mentioned to me was something called seeds. And that's where they implant radioactive seeds in your prostate. And over time, it kills the cancer cells.